Okay, so hi, I'm Dr. Carolyn Francavilla. I am the owner of Green Mountain Partners for Health. And like I was saying, I have been doing this membership model for the last year. So I'm going to start off talking a little bit about why we're doing this, what is great about it, and then let you hear a little bit from probably one of your doctors. And then we'll open up for Q&A. I don't think that this little presentation will take more than a few minutes, so maybe about 10 minutes of the presentation. If you have questions while we're going along, feel free to go ahead and pop those in the chat. If you'd like to ask them out loud, we'll have the opportunity to unmute and do that at the end of this little slideshow that I'm going to do here. So let me just share my screen here. All right, so we have officially launched our boutique healthcare membership, as we are calling it. And want to kind of go through a little bit of why this is. So when we founded Green Mountain Partners for Health, I founded it with Dr. Boyd about 8 years ago. And our goal really was to be independent, to not have to really answer to a hospital system or to insurance with what the best way to take care of our patients were. We really believe in that individual doctor-patient relationship. And I think all of us at the clinic, all 4 of us, really care about our patients. We come from a place of wanting to do what's best for our patients. And I think we constantly find ourselves wanting to do more for our patients. I've watched our docs. They constantly are tracking things for their patients on the computer system, reaching out, going above and beyond. And I think that's the sort of doctor we've always had at our practice, because that is sort of who goes to an independent practice, is someone who is committed to taking care of patients and doesn't want too much red tape getting in the way. Unfortunately, as our practice has grown, I think that there has become more burdens to being able to get directly in touch with your patient, and the administrative burdens in healthcare keep increasing and getting in the way of us being able to do the best thing for our patient. So over the last, 10 years or so, membership models of all different sorts have started to grow in popularity in healthcare. There are some that are more industry, like I've gotten a million emails from Forward here in the Denver area. CrossFit has one. There's things like SteadyMD. So those are kind of like online ones that might connect you with the doctor who's a good fit. They don't deal with insurance at all. So everything is a cash-based membership. There's DPCs where you pay to just, again, only cash. You're not involved with your insurance at all. Those usually are $100 or more in the Denver area, and they don't utilize your insurance for anything. And so if you do have insurance, you kind of feel like, well, what's the point? I'm not using that at all. So this model of what we're calling a boutique, sometimes people might call it a hybrid. When it costs a lot more, people call it concierge medicine. But essentially this model of adding something additional to what you already have, we believe, and I've seen over the past year, really lets us be the type of doctor we want to be and be more involved and more available for our patients. So essentially in this model, what we do is we have a $40 per month membership fee for the first adult in a household. And as a result, that allows you to have direct communication with your doctor. So this is not going through a system where a medical assistant or someone else is looking at that information and then getting back to you. That information is getting directly to your doctor in a timely fashion, and then they can respond directly back to you without any middlemen. And there's been a lot of benefits to that. This is the type of care that honestly I'm able to usually get as a physician, because most of my friends are doctors. And so if I have something weird come up for my kids or myself, I'm able to just text a friend and get some help. And I want to be able to offer that for my patients, but within the confines of insurance, there's really no way for that to work. And so for us to be able to add this additional level of care, providing a small membership fee was really the only way that we felt like we could be the sort of doctors we wanted to be. I'll share sort of a personal story, which is about 3 years ago, before COVID hit, my husband got really, really sick. And I'm a doctor, so when I say he was really sick, he was really sick. And we took him to the emergency room. They decided he wasn't going to die that night, so they sent him home, got him a follow-up with his PCP, who was a great guy, but part of a big system. They did some additional testing. didn't find an answer. And he just kept getting sicker and sicker. And I kept calling the office, trying to get a follow-up, trying to figure out what the next step would be. And I couldn't get through. I couldn't get next steps. It had been like 2 weeks and he was really concerning me with how sick he was. So I actually finally reached out to a friend of mine who had a membership model. And within a matter of days, we got all the testing done, got all the specialist referrals need. And I really saw the value of the membership model and having that direct ability, because even I, as a physician, couldn't navigate getting healthcare within a big system where again, there wasn't that direct communication. So I personally, really believed in this. And so last year I started doing this for my patient panel. So sorry, I want to make sure there was no one else who's trying to get in because I thought I heard a chime. Oh, well, they'll get the recording later. Over the past year, I've been doing this, and I started asking my patients over the last few months, like, what did you think of the membership? Like, what's been your experience? And they just sort of look at me and be like, I love it. Like that was all they had to say. They were like, obviously it's great. I love it. A lot of the experiences, I've had a lot of patients, unfortunately, get COVID this year. They message me, they tell me they have COVID. I message them back asking a few questions, and I'm able to like send them Paxlovid if they qualify for that. They're able to get that within a couple hours of finding out they have COVID. Lots of medication issues. The pharmacies have been a mess. Instead of having tons of back and forth with lots of middlemen, it's cutting down on that. There's still lots of challenges, but I can't even imagine how difficult it is without that direct communication. A patient, one of my first patients that I saw with the membership model, who always stands out, was a lady who had neck pain. She'd somehow never had neck pain before in her life. I asked her a few questions by text. I gave her a couple suggestions on what to do for a few days and said, hey, if that's not feeling better, let's get you an appointment. My quick answer solved her problem. She was able to avoid going to an urgent care. She was actually able to avoid a doctor's appointment altogether, but she also would have been able to get in right away if her symptoms hadn't gotten better. Same thing with colds and urinary tract infections. Sometimes we can just answer a question really quickly and get something started. Sometimes we can direct you to the right place to go, or again, we can usually get you in within 24 hours with this model, as opposed to going to urgent cares where you're seeing someone who doesn't really know your whole story. Another one I really enjoyed, I had a patient who got this huge wood splinter in his foot, able to get him in the same day, take it out. He got the care from his doctor who he knew, instead of going to an urgent care or an ER and possibly spending a lot more money than he would have been able to utilize his insurance in a regular clinical session. I've had a lot of people, I think, reach out about things they may have not reached out to so soon, or may not have at all, things like depression or sexual issues, where maybe they didn't feel as comfortable mentioning it face to face, but when they could just send a quick message, it was a lot easier for them to do. So those are some of the huge pros I've seen with this. I feel like I'm more available for my patients. I'm able to take care of their needs a lot better. And that accessibility, again, when I've asked my patients what they thought of the experience this year, the universal response was just them. I love it. Like, what else is there to say? It was great. So that's been my experience. I do want to give the docs a chance to kind of explain why they're excited about this model, why they think it is a good fit. Dr. Sapp, is it okay if I have you go first?
Yeah, sure. So Dr. Frankvilla had talked to us about this, I mean, essentially over the entire past year. And I was a little slow to grab onto it, was worried about what this might mean and how that translates into the communication patients need, and then also my experience in being able to give that much attention. And it's been really fun to see Dr. Frankvilla come back and say, no, I mean, I'm able to, she says she's been able to give the attention that patients need when they need it. And then that even gives the patients a sense of security that they know that that's going to be there. And so we can all kind of feel more comfortable in what's going on, because it's there when you need it. And if you don't need it, you don't have to reach out for it. And we can have that consistency for you. I mean, I know that I'm looking forward to, honestly, a lot of my family's coming on with us, because I do see kids. And so I mean, as a mom, and then we're thinking back to being a first-time mom, there's always plenty of questions. And so that's a really nice way for parents to get attention for those little things that maybe it wasn't a whole visit worth, but you wanted to be able to ask a question and just make sure that you're not worried about something that isn't a reasonable thing. And then just keeping track with updates. I mean, I'll have patients that are checking their blood pressures, and I just want to make sure that the medicine I started is actually working, and not wait 2 months to find that out later on. So I think that's going to be probably the biggest things that I can think of at this moment. And I know there's going to be a ton more as we all get more comfortable with the situation.
Dr. Sherman, do you want to give your thoughts next?
Sure. Hi, everybody. I'm Dr. Sherman. And yeah, I think I'm just pretty, well, I should say I'm just really extremely excited about this model because I think this allows me to give the type of care that I've always wanted to give. I left residency, or I finished residency a year and a half ago. And I purposely and intentionally joined this practice because it was independent, because I had more time with my patients. I was working at a big corporate system, and I just knew that wasn't the type of system that would work for me because it doesn't allow me to actually spend time with people, to actually get to know them, or to build the deep relationships. And that's really why I went into family medicine and why I love this field. And this model, I think, just allows me to give the type of care that I want to, where I would love for you to just be able to text me when you're feeling sick, or just let me know that you had trouble picking up your medication, or you're having a side effect to it. You're not sure what to do about it. Like, I would really love for me to be able to actually know those things that are happening with my patients, and I can respond in real time, and not, force you to come in for a visit 2 weeks later when by that point your issues are already resolved, or you ended up going to an urgent care instead because you just couldn't get in. We know those are frustrations for you as patients, and they're huge frustrations for us as physicians. Like, it doesn't feel good when we're not able to get you in, or our schedules are already so packed that we're running around, and we just feel like, to us, that just kind of feels like, oh my gosh, I just dropped the ball on that person. And that feels terrible. So we created this model so that we don't hopefully have to feel that way again, and that you can also always feel like your needs are met. When you need something, we're here for you. We got you, instead of this sort of, clunky system that we all know and well, that it's, has its limitations when we only work in a strict insurance model. It doesn't prioritize patient care. And that's really our goal with this model.
Thank you. That's really well said. And I think that's exactly, the intention behind the model, why I was interested in it, and why it has worked so well. It really does let us do the above and beyond that we all want to do for our patients. All right, Dr. Saul, I know you hate being in the hot seat, but it's your turn. Let us know. Tell us your thoughts.
Muted. I got it. I'm on my
There we
phone,
go.
so it's hard for me to see. Okay. And you can hear me okay?
Yes, we can.
Okay, cool. Perfect. All right. So pretty much, I mean, everything's kind of been said about, why the membership is great and why we all love the membership. I mean, we all kind of feel the same way. For me, I definitely can, I'm just starting to see some of the benefits because I've actually had some folks, actually new patients, sign up, and we've been messaging back and forth. And it's actually really nice to know that I can answer that question, because generally he would have just called and probably left a message at the front desk. And it was something simple like, can he see his labs on the messaging system, or how can he see that? So it was pretty quick and easy. And then his feedback was, when I told him about it, the program and all the benefits and all the perks, he was so excited for it. He said, wow, this is a great system. And he said, I love the way this office is run already. So, and I have experience from coming from a bigger corporate run place, which I only had like 15 minutes with my patients, and I hated it. And it wasn't really what I liked. And of course, the patients didn't really get the benefit of that visit. Nobody benefited from a 15-minute office visit. And so expanding like our physicals and giving more time for those, and allow like more questions to be addressed during that is very key. And that's a new thing, like with a membership model, I think is like an hour for the physicals. And we've already got half an hour for our visits and an hour with our new patients, which is so much more than what corporate medicine does. And so it really allows you that time to bond with your patients, and they see that we care, we spend time with them, connecting us at the touch of, a button like text messaging and email. I mean, it kind of just takes away like the middleman and the runaround and all the extra. So it's more streamlined, which is good for both parties. And so it's more efficient too, which is also good. But there's a lot of perks. Everybody kind of already talked about all the big things, but I'm super excited for the membership, and I know it's going to be a good one. It'll also make us feel good when we can answer people's questions right away, and instead of having like 2-day delay or a day delay, when it can be answered super quick in like the matter of a couple of minutes or less. And also save some money too. So
Yeah, I
prevent you from
definitely
going to
have
the urgent
many
care.
patients who, we were able to
So
get out of urgent care or emergency room this year. And
exactly.
you never know when that's going to come up. And also
Yep.
just having a doctor who knows you take care of that urgent
Mhm.
issue, I think is, I am often unpleased with the choices that doctors at urgent cares or emergency rooms make for my patients, because it may not fit in with like some of the big picture things I know about them. But when they're quickly taking care of someone and dealing with an urgent issue, they may make a different choice. So, well, thank you, Dr. Saul. So I'm just going to run through real quick. I know everyone got an email with all the details. That's going to be on the website, but people learn in different ways, and sometimes hearing it, I think has a different effect than seeing it. So, the goal is to really make this much more personalized. As we have grown, we have the logistics of, we have more staff, we have more information coming in and out. The practice has been in existence for more than 8 years now. So we have a lot of patients who, maybe are still affiliated with our practice, but really are not actively engaged, but we still get lots of, messages and things about them. And so all of that makes it a lot harder to get that direct patient physician contact. And so in this membership model, we are able to serve less patients, but serve them at a higher level. So we're going to have more availability for appointments, which I know has gotten harder over the last couple of years. Again, you're going to be able to message your doctor directly. We respond within that same business day, usually within about 4 hours. Your physical is going to have an hour dedicated. We're still going to bill your insurance for anything we have to do at that appointment for your physical, but instead of like having to come back for multiple visits because we kind of tell you, insurance doesn't really allow us to deal with this all at your physical. We know a lot of people like to come in and have their checklist once a year and go through a bunch of stuff. Now we can actually do what we know our patients have wanted for this year. So, So we talked about this upgraded physical. We're going to go ahead and have this optional Skin IO test. If you wanted to do that you can do. We have body composition testing if you want to do that. And again, we have this longer time for the physical that we are offering. Again, the direct messaging with the doctor, I think, has been the thing that I've gotten the most feedback about. People just love that direct access, and knowing that they're getting an answer from the doctor, not, it's like that game of telephone sometimes when you call, right? You leave a message for, a staff member, the staff member lets the doctor know, the doctor gives a message back to the staff member, maybe it's a different one, the staff member gives a message to you. And there's did it was the most efficient way to do it? Did we get, things done directly? And we know the whole story, right? When you message us. And so we can, again, directly take care of issues. And it's, I think, what we've always wanted to do. Insurance just hasn't really allowed us to practice that way. And we're kind of at a place now where like, well, who cares? Like, let's just do what's right instead of having these confines of what the system has created. Checking in is, again, so much easier. Like Dr. Sapp said, I think we think about our patients a lot between visits. That person will come to mind like, oh, hope they're doing okay with their new medicine, or, oh, I hope they're not having too many side effects, or I hope they're feeling better. And so it's much easier for you to reach out and let us know, or for us to reach out to you and know if you're getting better, which again, in the insurance-based model, that's a strict insurance model, there's really no mechanism for that. So in summary, this is $40 a month for the first adult. Second adult in the household is $30. And then children are only $10 a month, because we know it can add up really quickly for families, and we don't want to separate up our families. We have a 10% discount if you pay for the year in advance. And then we do have a small percentage of benefaction memberships that we're offering. So for people who this is a true financial hardship, where you're like, gosh, like this has been my doctor. I love this office, but you know, I'm on disability or I'm unemployed right now. And like, this is just not a possibility. You reach out to us. We have a little form that was in that email where that's one of the things you can request. You could also request your records be transferred someplace else on that form. So, but go ahead and utilize that form. Or again, if you're having trouble finding that, you can just go ahead and send an email to us. We do have a limited amount of that, of course, that we can offer, but we don't want to lose people just because they truly, you know, can't afford this option. So what about insurance? You know, insurance is sort of a necessary evil, right? You want your insurance when you need it. If you're really sick, if you need an expensive test, if you need surgery, you know, insurance is there for a reason. Healthcare can get really expensive. Primary care is not where it gets expensive, right? Our visits are not that much. And so for a lot of people with high deductibles, like you're basically paying for all this stuff anyways, we might be able to save you a visit or two a year, right? Like if we were having you come in just because that was the only way we were able to get paid before, but now we can have a 2-minute text exchange to solve your problem. For most people, they're coming in a little less often in this model because we can be more efficient. We don't have to only rely on insurance. We would still bill your insurance for any telehealth appointments, any office appointments, your physical, any labs that we do through the office, any testing. If you do have a high deductible or you have no insurance, we do have a cash discount on the labs that often can save you considerably. So that's a little bit of a process for us to do, but if you're one of those people where labs are really expensive, this does let us have a mechanism for that. And then of course, you're still going to use your insurance for all of your outside stuff for, you know, any referrals that you need, or if you go to the hospital. If you're out of network or you don't have insurance, you know, this model works great with cash pay. And again, it often allows us to be more efficient. And we have pretty low fees for the actual appointment. In most cases, your HSA or FSA can be used. That ultimately is between your HSA or FSA plan and you. Some of them will specifically exclude memberships, but a lot of our patients have been able to use that. That ultimately is your obligation to know, but many people have been able to use that. And again, if you have a high deductible plan or you don't have insurance, we often can avoid urgent cares or emergency rooms, which can have a lot of unexpected costs. So you should have the link to sign up. This link is here. I can probably put it in the chat too. It starts now. By April 1st, if you haven't selected the membership, we're going to start gently reminding you that you have to choose the membership or find another clinic. Our goal is not to abandon you guys. Our goal is not to take care of your needs. So if you need a month or two transition, or you need a refill while you're waiting in to get with a new doctor because this is not the right model for you, then you know, we're not going to disappear on you. We want to make sure your needs are met. But we are really passionate about moving to this model so that we can really provide this high level of care. So, you know, over the next several months, we are transitioning to this. Again, if you want these services now, sign up. We are going to have a limited amount of memberships, because to be able to provide this level of care, we need a little more time in our day to be able to answer these messages. You'll get a text within a couple of days right now that will give you all that information about how to message us. If you need something sooner than before you got that text, you can text us directly at our number or give us a call and we'll get you linked up a lot sooner. But right now it's about 1 or 2 days to get you all linked up once you have signed that link and paid. So I think those are all the details. I'm going to go ahead and open up to questions. It looks like there might be one in the chat. Let's see. So I'm currently on Cobra as I shop around insurance. Are there any insurances you won't be taking? Off the top of my head, it's usually some of the local plans that they're called that are on the exchange. And that is not our reason that we are not on those plans. It is usually because they won't allow us in their network. We try to be on every single plan, but I can have our staff reach out directly to you and let you know which plans are available. So if you have a list of which ones you're looking at, our office can definitely let you know if it's one that we take. Again, we try to take as many plans as possible. So I can definitely have the office reach out to you directly about that if you know which ones you're looking at. You don't have to commit to 1 year. So you do get a 10% discount if you pay for that full year in advance, but you can do it month to month, but you can't like pick and choose the month. So if you do it for 3 months and then you're like, this isn't for me, or I'm moving across the state or across the country, or you lose your job or whatever, you can cancel at any time. But you can't like bounce back and forth, right? And then again, if you needed like a short-term benefaction membership or something because something crazy happens down the line, we're here to serve you. We want to be available. So just reach out to us directly if there's something specific that's happening for you. But no, you don't have to commit to a year. It's month by month. But again, like you can't just like pop on and off of the membership. Other questions? And again, you can just pop those in the chat if you have questions. I think you can unmute yourself also if you are more of a talker than a typer. All right.
Hi.
Oh,
Hi.
I hear someone.
Hi, this is Charlotte. I have a couple of questions, actually.
Yeah.
Do you have to be seen for an ailment to text regarding that ailment?
No, so if let's say tomorrow you have a headache and you hadn't been seen for that before, could you message about it? Is that sort of what you're asking?
Yeah.
Yeah, absolutely. So that's often how things will start. Someone will be like, hey, I have this new headache. Now, new headaches are usually concerning to us. So that might be something where we would ask a few questions and then be like, we need an appointment. Like that's unusual to have a headache like that. We should do an exam. I'm trying to think of a better example. Maybe you have something weird happen. You get a bug bite and you're like, hey, does this look weird to you? And you send us a picture and we're like, no, I think that's going to be okay. If it gets a lot bigger or you have fevers or chills, please let me know right away so we can get you an appointment. But I think you can just watch it and put some Benadryl cream on it. Like we might give you some basic advice like that. So the threshold I have used, and we'll all kind of figure out our own thresholds with patients, is if I can read your whole message, answer it, and do anything I need to related to it in less than 5 minutes, that might be appropriate for a text. Sometimes I get whole paragraphs with like 3 issues and I'm like, that is probably time for an appointment so that we can, really actually address all those things. So if it's something where, again, we need to see you, sometimes belly pain, I'm like, I gotta see you, right? That could be an appendicitis. But you can always start that conversation by text. And again, we can let you know how soon you need to be seen if it seems really urgent. If maybe we're like, that sounds really terrible, you just actually should go to the ER. Or again, if we could do something for a couple days, if we could see if the thing will get better before you need an appointment. Did that answer your question?
It does. You had that depression thing on there, and a lot of people don't like to talk about depression. So that is a good example.
Yeah, we treat it a lot in our clinic. So we definitely all talk about it a lot, but it is something that's hard for people to talk about.
Perfect. And also, are you going to can we request a copy of your presentation?
Of this?
Yes.
Yes, that's the plan, is that we were recording it. Yep, it's recording. So unless there's a technology snafu, then that will go out by email with all the same information we sent before, but now with the email, with this in that link, and then that will at some point in the next week or so also be on our website.
Perfect. Thank you so much. Appreciate it.
Yeah, you're welcome. Thanks for joining us tonight. As of right now, there's a question about Medicare also. As of right now, we are still taking Medicare patients as they transition to Medicare. A lot's been up in the air with Medicare and how they pay doctors. But as of right now, when our patients transition to Medicare, we are continuing to take that. So, we always have to do it sort of makes sense. But as of right now, that's what we have done, is if you transition to Medicare, then we are still taking care of you. When we're seen in person, our insurance would be billed, and thus we would still be responsible for any copays. that is correct. So if you have a copay or a deductible or co-insurance or any of these crazy terms that they come up with, then you still are responsible for that. So everything for an actual appointment stays the same. If we see you in person, or if we're doing a telehealth, a Zoom that kind of looks like this, if it's an actual appointment, then everything stays the same. You still have your copay, deductible, co-insurance, whatever it is that you're responsible for, or if you're a cash pay patient, that cash pay price. Things that might have required a visit that can be handled by text. I think that becomes very, in my experience with the past year, very sort of patient dependent and situation dependent. So one example is when we start a medicine for depression or anxiety, we usually, as sort of a standard procedure that is accepted that we should do, see someone again in 2 or 3 weeks to make sure they're not having any side effects to the medication, see if it's helping, see if it needs to be adjusted. For some people, an appointment for that still may be appropriate. For some people, maybe they've been on a medicine before, or, it may be a quick text where we send a text that'll automatically go out in 2 or 3 weeks and say, hey, how are you doing on the medication? Are you okay going up as directed? And that again would have potentially been a visit in the past. And now we can potentially not do that visit depending on the, safety for that particular patient. Another example, again, some of those urgent things that come up where you're like, do I need to go to an urgent care? Do I need to be seen? A new rash, a new pain. I have people message me quite a bit about, a funny little pain that happened that day. Like, should they be concerned about it or not? I'm like, well, here's my thoughts. And if this, or this happens, let me know. And if it just goes away, great. So sometimes it's those things where maybe you wouldn't have gone to a doctor, but you kind of would have liked to, but if you had to pay a copay, maybe you wouldn't, and you're just kind of waiting and watching, and then all of a sudden it's the weekend and you're not sure if it's worse or not. So I think it also helps with those like in-betweens where maybe before you were avoiding going to the doctor for it, but now you're like, well, if I could just quickly get reassurance that I'm going to be okay, that would be helpful. So it does end up being very, patient specific. Some people are higher risk than others, right? If you're someone who has immune suppression, you're on chemotherapy or you're on prednisone, and you message us that you have a cough or a fever, we may want to do an appointment with you, right? You're more risky to get really sick. You may need a medication. If you're otherwise really, really healthy, we might just say, hey, watch this, this, and this. Here's some advice. And if this is happening, then let's see you for an appointment. If you get better, great. So again, it doesn't end up being very individualized. And part of it is like, we just have to do the right thing. If you're sick, we need to see you in person, right? If we can't answer the question quickly by text, we're going to do the right thing and see you. If again, it's more of like a reassurance or a quick check-in, a lot of times that works great by text. So I know that didn't entirely answer the question. And again, it ends up being very, I feel like, patient specific, what makes sense for you, because we're all about individual care here. So some people really need that appointment, and some people want the appointment too. They're like, oh, like, yeah, if you could see me today, that'd be great. I would really like that appointment to make sure everything's okay. So very individualized, which again is our kind of core value, I think, at Green Mountain Partners for Health, to provide individual care.
That's super helpful. Thank you. 2 things you just mentioned, and I don't know if I missed this part of the presentation, but kind of getting in for an appointment with the membership model, you're much more likely to be able to get in for an in-person appointment on a shorter notice.
Yeah, or telehealth, it's appropriate. I mean, telehealth is a lot more convenient for a lot of things. Sometimes, again, if you have belly pain, I think most of us like to feel your belly, see what you're looking like. We can tell a lot based on that. Sometimes lung stuff, we really need to listen to your lungs. If your heart's beating funny, we need to listen to your heart. But sometimes, we can manage things by a telehealth visit as well. But yes, we, in this model, we all, try to keep same day availability. So we usually can get you in within 24 hours. So if we can't get you in that day, we can get you in the next day. And again, we can usually start something by text as well. And worst case scenario, you might, because most of us work work like 4 days a week. So there's usually a day of week that we'll be answering messages, but we may not be in the office. And so on that day, if you really needed to be seen, you might see one of the other doctors, but we would still be in communication with you. So we would keep your individual plan in mind and work with our other colleague to take care of you. We all practice, I think, fairly similarly. We work well together. So, but again, our goal is for you to see your individual doctor or at least have their input. But yes, that has been one of the huge advantages of this is instead of trying to pack every second of the day to make sure that the clinic is financially sustainable, we now can keep a little bit more flexibility in the schedule to get urgent appointments in.
Yeah, that makes sense. I had one other question that might have gotten lost in the chat because I put several in.
sorry.
No, that's okay. And I was just asking if you could explain a little bit more the difference between like the current annual exam and then the annual exam, how it looks under the membership plan.
Yeah, so the annual exam is one of those things that's an artificial construct from insurance. So what insurance thinks an annual exam or a wellness visit is essentially your doctor going through a list of recommended preventive tests. So all the screening tests would be appropriate, whether that's blood work or lung cancer screening or colonoscopy or pap smears, and doing or ordering those tests as appropriate. Blood work, doing vaccines, and reviewing your family history to see if there are specific risk factors. So that's essentially what your insurance thinks a physical should be. I find most patients think their physical should be a time where they kind of just cover a little bit of everything, where they talk about their nutrition, they talk about exercise, they talk about stress, they talk about the weird thing that popped up on their arm skin-wise, the weird ache they've had in their shoulder, should they see PT? And so we sometimes address those things in physicals because like we're helpers, and when you bring up a complaint, we want to help address that, but it's not very efficient in the insurance model for us to do that. And so we usually schedule our physicals for 30 minutes. And so it doesn't give a lot of time for most people once we've gone through the checklist of all the preventive stuff that we want to do. And that's really important. It doesn't leave a lot of time for us to go ahead and get into some of those other things that maybe you want to address while you're there. So we now dedicate it, you get an hour-long appointment for that physical. So it really is kind of like your time to just talk about whatever above and beyond that, all the little things that maybe have accumulated through the year if you're not someone who sees us on a regular basis, as well as a little bit more of the things that you would think are preventive care, but from the insurance standpoint are like talking about nutrition, talking about exercise, talking about stress, talking about alcohol, talking about substances, talking about screen time, some of those things where, again, that's like a very individualized thing that patients want to talk about, but insurance doesn't think that's part of the physical.
Yeah, totally. And so like the insurance is still billed in that case for the annual wellness exam, whatever it is. And there's no additional fee on top of that for that additional.
So we are still
time.
If we're just addressing all the wellness stuff, that would be included. But if you're like, while I'm here, I also want to manage my high blood pressure, and I want to manage my depression, and I want to refill up this med, and I want to just do it all like, wham bam once a year. And I want to text throughout the year as I need you, but I really just want to come in once a year for my exam and try not to come in beyond that. If we are managing additional things, then we would bill your insurance for that additional management, just like we do now. So that's usually a code like it's like a 99214 for like an office visit. So then we would be billing for an office visit and a physical if we are doing that. But again, if it's just a more expanded physical where we're not getting into all of that, then we wouldn't bill for that, if that makes sense. But if we're truly like refilling meds and like managing new things, then that would be considered an office visit as well.
But
Got it. That makes sense
more efficient.
from the
But
perspective
often,
of
again, a
someone who
lot more
doesn't
efficient, 'cause
understand
normally we're like,
insurance
we
codes.
can't do all of that at once, but now we're like, we can do all of that at once. We're still going to bill your insurance or whatever system you're using for that. But now it's a lot more efficient because we've just given you permission to do that all in one visit. Whereas before we really tried to avoid doing that all in one visit.
Yeah, that makes sense. Thanks so much.
Yeah, thank you so much for joining us. And hopefully we can serve you with this membership. Okay, I think that's everything that's in the chat. Anyone else have questions? And again, if you have other things, you can shoot them to us by email or reach out to our office in whichever way you like to communicate with us currently. And before my kids pop in the door and get really loud, I think I'm gonna go ahead and end the recording.